Vascular surgery is a fascinating field in that it has really changed dramatically. It's a relatively young field. Vascular treatment of vascular disease really didn't get started until the 50s and 60s when we developed techniques for using surgery to bypass major diseased arteries. And this was worked very well for a long time, but over the last 50 years there's been a just tremendous explosion of knowledge of under what causes vascular disease and allowed us to try to intervene at an earlier point in the disease to prevent it from progressing to the point that might require major reconstructive surgery. And in addition to understanding the risk factors and having new medications to intervene to try to treat these risk factors, there's been tremendous explosion in technology of how to image the blood vessels to see where the disease is, how severe is it, how widespread is it. And most of these are now non-invasive techniques that used to be only diagnosed with invasive techniques. And finally, what's really transformed our whole approach to the treatment of the vascular lesions that require intervention has been the development of catheter-based, minimally invasive type of techniques, a whole set of new tools to treat the vascular lesions in a relatively simple, less intrusive type of fashion. And so that in our service at New York Presbyterian, probably only about 20% of people who are having some sort of treatment or intervention for their vascular problem are treated with traditional open surgery. In fact, now it's largely using minimally invasive techniques. And so the whole process has just changed dramatically. And so it's been very exciting to be part of that process, because this is sort of where I've been going for this time. And so it's really been fun, and just requires constant retraining and being open to new techniques and new ideas, all of which we've been able to utilize here because this is a very large academic institution which can draw on just tremendous resources, both in terms of basic science and basic imaging techniques, which have really been at the forefront of our treatment program.